The Arrhythmia Alliance, as you heard from Glenn, is just 10 years old. And you'll hear the story of how it came about from Richard Schilling, who's going to talk to you next. But it was a pressing medical emergency in an administrative sense that pulled all elements of people concerned with cardiac arrhythmias together in this country. And the whole idea of the Arrhythmia Alliance was that we could together achieve a lot that we couldn't do individually. The idea was to get people from both sides of every story. So we wanted to have patients, we wanted to have their carers, we wanted to have doctors, we wanted to have nurses, we wanted to have physiologists, we wanted to have people on the commercial side dealing with the supply of medical products. We wanted to have researchers belonging to the association, and we wanted to get people who were involved in the administration of healthcare. People from the Department of Health, people from the PCTs, now the Clinical Commissioning Groups. We wanted to get everybody round the same table and singing from the same hymn sheet. In other words, the whole idea was not to have an us against them scenario. We wanted a collaborative, cooperative approach to try and move things forward. And things have moved forward a very great deal. 10 years of progress with the Arrhythmia Alliance. And what sort of things do we do? You've heard some of them from Glenn. I'll tell you a few other issues. For example, we work in conjunction with the professional society called now the British Heart Rhythm Society, which is involved in looking after the care and education of professionals, particularly doctors, but also nurses and physiologists and other people involved on the professional side. So the Arrhythmia Alliance works very closely with the British Heart Rhythm Society. And one of their initiatives is the so-called Heart Rhythm Congress, UK it's called. And this Heart Rhythm Congress has been going now for 9 years because it was one of our very first initiatives. Now, initially we had, I think, 800 people at the first of these meetings. We now have in excess of 3,000 people coming to these annual meetings. And these meetings are not just for docs and professionals. The first day is specifically for patients, and I see around the room several of the people who come to those patient days. So doctors and arrhythmia nurses and physiologists turn up to talk specifically with patients, and patients talk to each other, of course. It's a good way in which to spread the message for doctors and professionals to hear what concerns patients as a group, and vice versa. So that's a very good initiative, and it works extremely well. Another initiative from the Arrhythmia Alliance are the so-called regional meetings. The regional meetings is where the Arrhythmia Alliance designs a program that will take messages, if you like, from the centre, in inverted commas, to the regions. And they will design a program. It will be reorganized according to what the local problems are. And then local people are mostly engaged in doing the talking. But it's all under the auspices of the Arrhythmia Alliance. Initially it was 6 a year, and the main reason was to try and spread the word about the change in the National Service Framework, which Richard will tell you about in a moment. But now it's essentially just to spread the message and make sure that everybody is well informed, and that we in turn at the Arrhythmia Alliance know what is going on in the regions. Now we have many strings to our bow, but I think the one that I should mention most to you is the Arrhythmia Awareness Week, and many of you will know that we've just finished this year's Arrhythmia Awareness Week. This occurs in the early part of June, first week of June each year, And it's an effort to get people to concentrate on the issue of cardiac arrhythmias. And we encourage, for example, GP surgeries, schools, church halls, hospitals, anybody where there's a facility, a wish, we encourage them to hold meetings and to develop projects for the Arrhythmia Awareness Week. We know this time that we had a big impact in terms of numbers involved through the social media. Of course, I know nothing about the social media, but I understand there's a technique called thunderclap. Many of you may be involved in this. And you register with thunderclap, and then when your event starts, the clap occurs, and all the registrants, followers, are all informed about the Arrhythmia Awareness Week. So in one thunderclap, we got over 1 million people informed about the Arrhythmia Alliance and the Arrhythmia Awareness Week. And then, of course, it cascades out and multiplies out from that. And I hope by now we've had 100 million people who know something, not very much probably by the end of the chain, but something about the Arrhythmia Alliance. So that was the social media side. And of course there are many events going on all around the place. We haven't totaled them up yet because it was only last week, but we do know that over 250,000 pieces of educational material left the Arrhythmia Alliance for distribution and was distributed during the Arrhythmia Awareness Week. So that's a big amount of information to get over, pass across to those who need it. The other thing, which was a first for the Arrhythmia Awareness Week this year, was a project which involved pharmacists. These were pharmacists in North London who got together to do a big effort to follow on from this campaign, the Know Your Pulse campaign. The idea was that they would feel the pulse of patients, or they would then use various devices like the AliveCore device, which is over there, or the MicroLife system that's over there, to try and find out if people had a cardiac arrhythmia. Over 1,000 patients were examined or involved in this very first week of the effort. And we know that quite a few arrhythmias were discovered. We haven't got the feedback from the medical side yet, but certainly we discovered a lot of unknown arrhythmia. Interestingly, we found some people who had atrial fibrillation and were being treated for atrial fibrillation, but they didn't know they had atrial fibrillation. They'd never heard of atrial fibrillation. Now that's a first for me, and I think that that's a great discovery, and we should think more about that, finding out if people with this condition know what it is and what it's called. As Glyn said, he'd never heard of it, and of course one of the main reasons is atrial fibrillation is a long phrase, difficult to remember. Many people can't pronounce it, particularly when they're just reading it. They don't know how to say the word. So most of us are now saying AFib or AF, and we drop the rest. And I hope we can take it forward with, in that sort of way. Now this is part of a parliamentary effort. We're in the Houses of Parliament today, and you heard Glenn talking about the all-party parliamentary group on atrial fibrillation, and there are several others with which the Arrhythmia Alliance are also involved, and which have been initiated through the Arrhythmia Alliance. And these are very good enterprises. We're trying to make sure that those who make the rules, who draw the laws, and who are involved in the health service in this country know all about the problems that many of us in this room have, whether it's from the professional side or the patient side. And that is working very well. It's also working well in the European Parliament and the European Commission. We've also been involved in talking to the Parliament and talking to the Commission. And I don't know if you realise, but there has been a sea change in the World Health Organization attitude to what they call non-communicable disease. They've mostly been interested in malaria and stuff like that, but a lot of that is being contained, and now they realize that there's an even bigger challenge, and that is people growing old with so-called chronic disease. And so the World Health Organization needs to put some steam behind the development of equity of access and issues like that for people with these diseases. There are some obvious diseases, such as, for example, Alzheimer's disease, that had already been picked up by the Commission in Brussels, but they hadn't picked up heart disease, they hadn't picked up stroke, and of course they hadn't picked up atrial fibrillation. But through our organisation, they are now well aware of it, and in his opening address to the Commission's Chronic Disease Management Summit, Tonio Borg, who was, I suppose now, the Commissioner for Health, mentioned in the first paragraph of his speech atrial fibrillation and stroke, and how that would be a very good example to tackle at a European level. So that's a major success. The Arrhythmia Alliance has had lots of successes in its first 10 years.